I'm Shayna Diamond with the American Cancer Society, and March is Colorectal Cancer Awareness Month. So we spoke to Dignity Health colorectal surgeons about how screening can save lives.
Colon cancer is the third leading cause of cancer-related death in the United States. The outcome and the management is primarily based off the stage. Colonoscopy or colon cancer screening aims to detect cancers as an earlier stage. It's not only a detection or screening test, but it's also a preventative test, meaning that most colon cancers arise from a colon polyp, a small precancerous growth, and through colonoscopy, we can remove those polyps. So colonoscopy provides both also screening as well as prevention. So we are seeing a higher rise of incidence of colon cancer in younger patients. That is something that we are seeing more frequently recently. For a long time, it's been seen that particularly in African American populations, that those patients have a higher risk for colon cancer. Not only do they have a higher risk, but in general, their aggressiveness of their tumor, so they have poor outcomes as well. So screening, particularly for African American communities or persons, is very important. So there are all alternatives to colonoscopy. This is mostly stool-based testing. So 3 types of stool-based testing is the FIT test, fecal occult blood test, as well as a stool DNA, or what is commonly called a Cologuard. All of these tests are stool-based. You send a stool sample and they're trying to look for either blood or DNA changes that would imply that there's a chance that you have colon cancer. The main disadvantage to stool-based tests is that if they are positive, you still do need a colonoscopy. And while stool-based tests are important or useful for screening, they don't provide any prevention. So during colonoscopies, we definitely remove polyps. Polyps are small growths, initial precancerous lesions. And through removing these lesions, we can actually prevent colon cancers from forming. So if a patient is hesitant about a colonoscopy, I want to try to understand what is causing their hesitation. For a lot of patients, this is either prior colonoscopies that they've already had or patients' families' experience with colonoscopy. A very common concern for patients is the bowel prep. But today we have many different types of bowel preps and formulations that are much easier for patients to tolerate. When I first started to be a colorectal surgeon, I saw a lot of hospital patients, particularly young patients, coming in with colon cancers that are very advanced. When you present with colon cancer with symptoms, it's typically very advanced because the colon cancer itself has to become large enough to become symptomatic. I find that to be very disappointing because we do have methods of screening and detecting these cancers at an earlier stage. So if anything I can do to prevent that from happening to someone else, I'm happy to do it.